Alright, today we're going to talk a little bit about post-operative exercises after shoulder surgery or shoulder arthroscopy. And these will be a guideline for you to do your rehab exercises with the assistance of your therapist, but also to do home exercises. Mark, our PA, is going to help demonstrate that for us today. The first thing that we want to realize is when we do shoulder surgery, we didn't operate on the wrist, hand, or the elbow. We want to use those normally. So we want to move the fingers and make a fist. We want to move the wrist. And you want to move the elbow, making sure that you get your elbow completely straight. We don't want to sit in the sling the whole time like this, otherwise the elbow will get stiff, and so we want to use the elbow normally. So when we talk about the shoulder, when we're starting to do shoulder exercises, we want to do them in an incremental and progressive manner. And the first thing that we want to be able to do is to do pendulum exercises. And these are exercises where you use the other hand to stabilize your body, and you lean forward, and just like the pendulum of a grandfather clock, you want to make small circles, and we start off clockwise, getting bigger. And in a similar way, we want to do counterclockwise motion, where we start with small circles and get bigger. And this helps loosen the shoulder and the capsule to help with the other exercises of the shoulder. The next thing we want to work on is forward elevation. This is where we try to lift the arm up in the front of your body. And when we do this, we want to do it in a passive manner. It's very important to distinguish between passive motion and active motion. When we're rehabbing the shoulder, particularly when we have done repairs of the rotator cuff or the labrum, we don't want to actively lift the arm up on our own. Rather, either with a therapist or with Mark using his other arm, we want to work on raising the arm up. We hold it for a count of 5 to 8 seconds, and the goal over the course of 6 weeks is to get the arm all the way up. This is not going to happen right away. It's going to take a lot of effort by going to physical therapy as well as doing your home exercise to do that. So when we raise it, we want to raise it up incrementally, 5 to 8 seconds, hold in a very slow and steady manner, come back down, and work on getting it all the way up. The second exercise that we want to work on is abduction. This is lifting your arm to the side. A little harder to do on your own, but the therapist can assist you with this as well. Same thing, you're using the other hand to lift the arm up to the side, holding it for a count of 5 to 8 seconds, and then coming down. These are all critical exercises to ensure a successful outcome after shoulder reconstructive surgery. It's just a guideline. We go over these guidelines and exercise with you in the office, but this is just a review online so you can understand what you need to do.